Hello everyone, my name is Sarah. I am a certified clinical nutritionist specialized in medical nutrition therapy and community nutrition. I have created 2 video books on polycystic ovarian syndrome. So I decided to give you a summary of first part of the video book. I'll be telling you a brief description of each chapter one by one, so it would be easier for you guys to get deep understanding of each chapter of the V-book. So without any further ado, let's get started. In the first chapter of the video book of part 1, I have discussed about what exactly PCOS is. Polycystic ovarian syndrome is the endocrine disorder, and it affects the women of reproductive age. This disease is quite common, and it badly affects the ovaries of a female. If we talk about the complications of PCOS, that can include infertility, gestational diabetes or pregnancy-induced high blood pressure, miscarriage or premature birth, non-alcoholic steatohepatitis. It is a severe liver inflammation and it is caused by fat accumulation in the liver. Metabolic syndrome, a cluster of conditions including high blood pressure, high sugar, and abnormal cholesterol or triglyceride levels that significantly increase the risk of cardiovascular disease. Type 2 diabetes or prediabetes, obstructive sleep apnea, depression, anxiety, and eating disorder, abnormal uterine bleeding, and cancer of the uterine lining, which is also known as endometrial cancer. As you can see in this diagram, there is a clear difference between normal ovary and the polycystic ovary. Now let me tell you about 3 major features of PCOS. Number 1 is excess androgen levels. Number 2 is irregular periods. And number 3 is polycystic ovaries. In one study, women with PCOS had higher HOMA-IR score. If you see in this table, the normal range of HOMA-IR score is 0.5 to 1.4. If it is less than 1.0, it means that you have insulin sensitivity. If it is 1.9 or greater than 1.9, it means early insulin resistance is there. If it is above 2.9, it indicates significant insulin resistance. Now, what can be the symptoms of PCOS? The common symptoms of PCOS are hair growth, irregular periods, acne, weight gain, heavy bleeding. Do you know that average blood loss during regular periods is 40 ml? However, in women suffering from polycystic ovarian syndrome, 80 ml of blood is passed, and women experience clotting as well during periods. The 6th symptom is male pattern baldness. The 7th one is headache, and the 8th one is fertility issues. If the PCOS is left untreated or not treated on time, then it can lead to several long-term health complications, such as insulin resistance and diabetes, high blood pressure, cancer, depression and mood swings, snoring and daytime drowsiness. The further detail about symptoms and features of polycystic ovarian syndrome is available in the first chapter of the video book, so you can check that. Now move on and talk about chapter 2. In the chapter 2, I have talked about the types of PCOS. There are several different types of PCOS, so it is highly important for you to know about from which type of PCOS you are suffering from. So the first type of PCOS is known as insulin-resistant PCOS. This is the most common type of PCOS and is the result of high insulin level in the body, which can also be called metabolic or pre-diabetic syndrome. The second type of PCOS is post-pill type of PCOS. As the name indicates, the signs of this type of PCOS begin few months after the exit of oral contraceptive pills. How this type of polycystic ovarian syndrome can be treated, for that you need to see the dietary guidelines that I have created for this, and that is available in my book. The third one is inflammatory type of PCOS. This type of PCOS occur due to chronic inflammation in the body, and high inflammation results in hyperactive immune system that can stimulate ovaries to make more androgens. Signs, symptoms, and a detailed link of low-grade inflammation with endocrine disorder PCOS is in Chapter 2. Additionally, Nutritional Management of Inflammatory Type of PCOS is also available in the video book, so you can see that. The third type of PCOS is adrenal type of PCOS. Ladies with adrenal polycystic ovarian syndrome encounter significant stress levels. They will have undeniable degrees of DHEAS, dehydroepiandrosterone, an androgen delivered in the adrenal organs, and typical degrees of different androgens created in the ovaries, like testosterone and androstenedione. You can see the detail in the Dietary Management of PCOs video book. The detail of lean body type of PCOS as well as secret cause type of PCOS is also available in the book, so you can check that. Now there are three different kinds of omega-3 fatty acids. Number one is ALA. It is the unsaturated fat. Number two is EPA. It is beneficial for polycystic ovarian syndrome patients. And DHA, it is found in greasy fish, salmon, and sardines. Diabetes is a major complication of PCOS, and if you are suffering from polycystic ovarian syndrome, then chances of developing diabetes increases. If we talk about Chapter 3, Chapter 3 is all about the causes of polycystic ovarian syndrome. Do you know what are the causes of PCOS? The majority of polycystic ovarian syndrome manifestations are brought about by higher than ordinary degrees of chemicals called androgens. Specialists do not know precisely what causes PCOS. They accept that undeniable degrees of male chemicals keep ovaries from creating chemicals and making eggs ordinarily. Scientists and medical experts realize that natural and hereditary components add to polycystic ovary condition advancement. Now, there are several reasons that lead to PCOS. For further details about the causes of polycystic ovarian syndrome, you have got to watch Chapter 3. So now there are several different causes of PCOS, such as genes, insulin, environmental factors, obesity, inflammation, androgens, and heredity. Researchers and healthcare providers know that genetic and environmental factors contribute to the development of PCOS, but do not know exactly what causes PCOS. So for further detail about the main causes of PCOS, how they affect and how they lead towards PCOS, for that you need to see Chapter 3. In the Chapter 4, I have talked about the diagnosis of polycystic ovarian syndrome. How can you diagnose that you are suffering from PCOS? Up to 70% of affected women remain undiagnosed or have long delays before the condition is acknowledged. The prevalence is generally considered to be between 6 to 20%, depending on the definition and the population under consideration. Chapter 4 is about the diagnosis of polycystic ovarian syndrome. In previous years, it was deemed as a disorder of older women, but recent evidence suggests that PCOS is a lifelong syndrome, manifesting as early as prenatal age. It is a noteworthy public issue. There are 3 different diagnostic criteria that have been established to diagnose PCOS. Number 1 is NIH-HA, PCOM, ESHRM/ASRM. Number 3 is ovulation dysfunction. So let's talk about these three diagnostic criteria one by one. The first diagnostic attempt was made by the National Institute of Health in 1990 and included both hyperandrogenism and oligo or anovulation as the two criteria to diagnose PCOS. The second diagnostic criteria is Rotterdam criteria. It was established by Rotterdam, ESHRE/ESRM, the American Society for Reproductive Medicine and the European Society of Human Reproduction Embryology. Sponsored PCOS consensus workshop group in 2003, which adopted polycystic ovarian morphology, ultrasound finding of polycystic ovaries. The third one is the ovulation dysfunction. The detail of these three diagnostic criteria is available in the video book. Only to treat current symptoms is not sufficient in PCOS, but we must try to prevent any long-term morbidity. Therefore, screening recommendations are an essential part of the management of PCOS. Now, the screening of disorders that are related to PCOS is necessary, such as screening for type 2 diabetes and gestational diabetes, screening for CVD, cardiovascular disease, gynecologic ultrasonography. There are various laboratory tests that are required to diagnose the presence of fluid-filled sacs in the ovaries, known as cysts. In the chapter 5, I have discussed about how polycystic ovarian syndrome affects the psychological health of the females. Polycystic ovarian syndrome not only affects your body, but it also adversely affects your mental health. The incidence of PCOS is on the rise due to stress and changes in the lifestyle. Currently, the incidence stands at 4 to 6% of women. Studies have shown that PCOS is the most common cause of lack of ovulation, which is known as anovulation. Again, many studies have shown that about 20 to 25% of women who exhibit normal ovulation have polycystic ovaries, as supported by ultrasound findings. This speaks to the possibility of seeing an increase in the incidence numbers soon. In Chapter 5 of Dietary Management of PCOs video book, I have given a detailed presentation on how PCOS is affecting the psychological health of females, so you can see that. If we talk about the pathophysiology of PCOS, the female hypothalamic pituitary ovarian axis is responsible for the competence of her reproductive and the survival of her species. Environmental factors, hormonal and neuronal signals dictate the way HPO axis responds. This kind of association begins from gestation and proceeds to impact future generations by affecting the developing germ cells and the developing brain. If we see in this diagram the pathophysiology of polycystic ovarian syndrome. In the pituitary gland, when you are suffering from PCOS, in your pituitary gland, the luteinizing hormone secretion starts getting increased and the secretion of follicle-stimulating hormones start getting decreased. And in the ovaries, impaired development of follicles starts getting increased, as well as it leads to hyperandrogenism. And hyperandrogenism leads towards hirsutism, acne, and alopecia. Hyperinsulinemia and insulin resistance leads towards obesity. Obesity leads towards increasing extraglandular aromatization in the adipose tissue. And in the ovaries, when impaired development of follicles is increasing, it also leads to chronic anovulation. And all these health issues are interlinked. The further description is in the V-book. There are several mental health conditions that are associated with PCOS, such as increased risk of depression and anxiety, reduced quality of life, distress around body image, eating disorders, sexual dysfunction, distress around higher BMI, lowered efficacy, and fear for future life. The link of these 8 health conditions with hormonal disorder PCOS is quite important to know. Depression and anxiety are the most common psychological issues PCOS females face. Notably, if you are obese, mood disorders rises, and therefore patients persistently experience low moods that may increase insulin resistance that cause hyperinsulinemia. Furthermore, due to the elevated androgen in the depressed PCOS patients, more hyperandrogenism features like acne, hirsutism, seborrhea, and hair loss further reduces the self-esteem of these patients due to a poor perceived self-image. With this, their self-confidence gets crushed, increasing the level of psychological distress, resulting in social withdrawal and high depression scores. Severe psychological problems may also result in suicidal ideations, which may have fatal outcomes. So, this was the brief description of my video book Part 1, titled Dietary Management of PCOs. For more information, I would recommend you to watch my video book. Thank you.